Today we will discuss about anaphylaxis. So, what is anaphylaxis? It is a hypersensitivity, life-threatening reaction. So, basically, it is IgE mediated. So, what happens here is like because of this hypersensitivity, there will be rapid hypotension, tachycardia, and there will be life threatening airway compromise. Life threatening airway compromise and bronchoconstriction or bronchospasm. So it happens very suddenly. So what are the causes that leads to this hypersensitivity reaction, anaphylactic reaction? So namely antibiotics and anesthetic drugs, like for example lignocaine and contrast media and food allergy. Regarding food, for example nuts and other stuff, and rose thorns may also cause hypersensitivity reactions, and insect stings. Yeah, those are the some of the common causes. And then what see a short just a minute I will explain you what happens during the anaphylactic reactions. See, suppose there is an antigen, for example some insect stings. Take it, insect stings. What happens is like in our body there is a cell called antigen presenting cell. This will recognize this antigen, and then this will present this antigen to T helper cells. Okay, and T helper cells, what they will do, they will release inflammatory mediators, for example IL-4 and IL-12, and these IL-4 and IL-12 will be taken up by B cells. B cells, what they will do after getting attached to these molecules, they will produce IgA antibody. An anti-G antibody they will produce, and this will be released into the bloodstream, and these IgA antibodies, they will get attached to mast cells. These are the main cells which play a major role in anaphylactic reaction. So what happens, suppose this is a mast cell and there is IgA. So on further exposure to the allergen, suppose this allergen is attached to this antibody, and then what happens, immediately after attaching to this antibody, these mast cells will be releasing inflammatory mediators, because mast cells will be having granules inside the cell, and these granules attach to the cell wall, and from there inflammatory mediators like histamine will be released into the bloodstream. And this histamine, what it will cause, it will cause bronchoconstriction, as we mentioned earlier, bronchoconstriction, vasodilation. So there are many inflammatory mediators. I'm just mentioning here just histamine. And what happens, these small granules, these will go and activate other cells, other mast cells, and those mast cells also will release inflammatory mediators. It's like a chain reaction inside our body, right? So that is the thing that is causing all these changes in our body. And then what happens? See, now I will explain you the symptoms. First we will take the airway. What happens to the airway? Patient will be having stridor, hoarseness of voice. Remember, this is the very important thing, hoarseness of voice. And then we come to breathing. What happens in breathing? Patient will be having wheeze, cyanosis, and SpO2 will be less than 94%. And regarding circulation part, circulation, there will be decreased BP. Patient will be in shock. Because of shock, patient will be in confusion, and cold clammy skin will be there because of hypotension. So what do you do? For the airway, we will put oxygen. We will provide oxygen to the patient. Sorry, for airway, what we will do for airway? We will give nebulized adrenaline. Nebulized adrenaline we can give 1 ml. We can give. And then for breathing, put oxygen. And then for circulation part, give bolus 500 to 1000 ml. 1000 ml NS you have to give. If the patient is a small kid, in children, 10 ml per kg bolus you can give. And then for the drug part, what you will give usually? Hydrocortisone 100 mg in adults you can give. And then after this one, what we will do? We will give adrenaline. We will give IM 0.5 mg or 500 microgram. So where we will give? Actually, we will give it the this is very important, anterolateral aspect of middle third, anterolateral aspect of middle third of thigh you have to give. So after giving this adrenaline, wait for 5 minutes. If the symptoms did not subside, again you give one more dose. So again wait for 5 minutes. So after giving two doses of adrenaline, if the symptoms are not subsiding, then we call it as refractory anaphylaxis. So what is refractory anaphylaxis? Despite giving two doses of adrenaline, still the patient is in anaphylactic shock. We call it as refractory anaphylaxis. And then what do you do for the refractory anaphylaxis? We have to start adrenaline infusion. So how to give infusion? Take 1 mg adrenaline in 100 ml normal saline, and then give at a rate of 0.5 to 1 ml per kg per hour. So this is important, 0.5 to 1 ml per kg per hour adrenaline infusion you have to start. And in case if the patient is not still in hypotension, suppose the patient is not improving his BP, you can add one more vasopressor like noradrenaline or vasopressin, and then maintain the vitals. See, a very important thing in anaphylactic shock is if the patient is having hoarseness, So you have to immediately give adrenaline. So it is very important to talk to the patient and see if any change in voice. So if you leave the patient like that, then patient will be developing laryngeal edema. So complete airway obstruction will be there. Airway obstruction will be there, and you can't even intubate the patient at that time. So it is very important to recognize the hoarseness of voice. This is very, very important. Thank you.